The Tego connector is the only catheter protection device available today specifically designed for hemodialysis catheters. The ability of the Tego to prevent contamination of the catheter while performing the hemodialysis treatment is demonstrated in this model. The Tego is made up of two components, the internal body and an outer silicone sheath. The Tego is attached directly to each hub of the central venous catheter, creating a microbiologically and mechanically closed system. To access the Tego, first thoroughly disinfect the female lure with a desired disinfectant according to your facility policies and procedures. To perform the dialysis treatment, first withdraw and discard 5 milliliters of fluid from each catheter lumen. Swab the Tego again, and then flush each lumen with 10 milliliters of normal saline. Attach the heparin loading dose to the venous limb if ordered. Gently flush heparin back and forth 3 to 5 times into the catheter. Do not initiate dialysis for 5 minutes after administering the heparin loading dose. Swab the Tego again. Next, attach the dialysis bloodlines directly to the Tego. By grasping the rotating collar, push and twist the bloodlines into the Tego until secure. Be certain you have a secure connection, but do not over-tighten, as this may damage the Tego. The end of the collar should be flush with the ridge of the Tego. You can now begin your hemodialysis treatment. The Tego has a unique straight-through unobstructed fluid path, which is critical for maintaining the integrity of the blood while still providing a flow rate of more than 600 milliliters per minute. After the treatment is complete, clamp the central venous catheter limbs and bloodlines. Then disconnect the bloodline by grasping both the Tego and bloodline collar. Hold the Tego secure while twisting the bloodline collar and completely unthread it from the Tego, then pull to disconnect. Swab the Tego again. Finally, the Tego should be flushed with 10 milliliters of normal saline. It is important to use 10 full milliliters of flush from a 10 milliliter syringe, not 2 5 milliliter syringes. This reduces the manipulations and therefore the risk of contamination and thrombotic occlusion. To avoid any negative pressure that is associated with compressing the plunger to the bottom of the syringe, do not push all the fluid and leave a small amount of fluid remaining in the syringe. Clamp the lines according to your facility policies and procedures. Heparin is not required to maintain the patency of the catheter. The patient is now ready to go home. Dress the catheter site and extensions in accordance with facility protocol. The Tego will remain in place for a week. It maintains a seal, thus preventing contamination of the catheter or fluid path at all times. The Tego may be used to conduct blood draws using a syringe or vacutainer adapter. To draw blood using a vacutainer, first swab the Tego. Withdraw and discard 5 milliliters of fluid. Attach a 10 milliliter syringe to the arterial Tego connector. Gently flush blood back and forth a minimum of 5 times before attaching a vacutainer adapter. Insert the adapter with a push and a quarter turn. Do not insert too deeply, as this may damage the Tego. When removing the adapter, be sure to twist the adapter in the same direction to ensure that the needle is not removed and exposed. Swab the Tego again. Finally, the Tego should be flushed with 10 milliliters of normal saline. Never before in dialysis, a microbiologically and mechanically closed system for central venous catheters. Tego, to cover, shield, protect, and defend.